So for those of you who don't know me, my name is Melissa. I am the senior manager for academic and industry relations for the specialty side of the business for Aspen Dental. Surprisingly to most people, I don't actually work for Aspen Dental. I work for TAG, which is short for the Aspen Group. The Aspen Dental practices are owned by general dentists. So sometimes Aspen gets lumped into that kind of corporate dentistry group. And for us, it's a little bit different because working for TAG and the Aspen Group, that's kind of the corporate entity. But the practices are essentially private practices and they're owned by general dentists. So where TAG comes in, where the Aspen Group comes in, is we provide support to the offices and to the clinicians in the practices for anything that has to do with like the business side of things. So if it doesn't actually include sitting something clinical or seeing a patient in a chair, that's what TAG will provide for the office. So what does that mean? That is everything from finding the real estate to equipping the office, supplies, working with the insurance companies, dealing with the malpractice insurance, making sure that we have everything as far as a HIPAA compliant IT network, our practice management software. So all of these things that if you've never owned a business before, and especially a dental practice, you maybe aren't even thinking about. But these are all things that obviously a practice needs in order to run. And these are the services that we provide. And last but not least is obviously recruiting and staffing, which is where I come in. Myself and my team work on the talent acquisition side of the business. And so we help the general dentists who own the practices find staffing specifically for myself and my team at specialists. So the two specialties that Aspen employs are oral surgeons and endodontists. And myself, Kristen and Ed, who some of you on the call also might know, we kind of travel the country. We meet with residents in endo and OS programs all over the country. And we do dinners and we do events and we get to know you guys a little bit, have you get to know us a little bit, and hopefully give you some insight into just different options that are out there, you know, what makes Aspen a good choice for some, just give you the information that you need to make good informed decisions. And then, you know, when you're ready to complete residency or when you're in your final year and you're ready to start making those decisions, hopefully we can be the ones to help you out. So with that being said, I will introduce Dr. Desmond Brown, who is our VP of Oral Surgery Support for Aspen. And I'll let him kind of go through his journey with Aspen and introduce himself.
Thanks, Mel. So I don't know if I've met any of you on my runs around the country, but I'm Des Brown. I am the VP of Oral Surgery Support with Aspen Dental. I used to be in the field full-time. I worked for Aspen for approximately 10 years. I did it as a part-time position. Concurrently, I also did clear choice, and I am also on staff faculty at IU. At one point, I was actually the program director, and I transitioned into an adjunct faculty now. So let me start from change the slideshow.
I mean, you wouldn't be a good parent otherwise.
So as I was saying, guys, my journey, I just like many of you, when I left residency, we had a lot of decisions to make in terms of the future, where I wanted to go, what I wanted to do. I loved academia, as I thought, and it was great. I did it for about 2 years. Aspen decided that they wanted to venture off into the implant world, which is probably one of the better decisions that they've made. And they definitely started off very successfully with what was called Turning Point Dental Implant Center. It was pretty much very similar to Clear Choice Centers. About 3 years ago, Clear Choice came in and bought Turning Point. And then, as many of you know, the Aspen Group came back around and bought Clear Choice. So I worked with Turning Point to Aspen to Clear Choice to Aspen again. So I do a mixture of stuff. about 18 months ago, I took on this new role, and it just goes to show the commitment that Aspen continues to make in our specialty program. So when I started, Aspen is 25 years next year. When I started approximately 10 years ago, the specialty team had, I believe, one person on it. And now we have a very fully staffed support system. What does that mean? It means that just what the DSO stands for, we are providing support. And obviously, the more people that we have on staff is the more we all feel supported in the field. Um, so, what does it look like to be a specialist at Aspen? I get this question tons of times. I should be able to rack it off, but not to confuse anybody. And we're going to give you guys a chance to ask questions. However, but you have an exclusive territory. So what does that mean? You are not competing with other Aspen surgeons in any office. So you are the sole surgeons in the office. So you have a specific number of offices that you commit to whenever you sign your original contract. You also have a built-in referral network. So I'm very clear to this because this is what helped me to be successful in my own practice. It's a built-in referral network, but you still have to play your part in building that relationship and that communication. So you are not going out to offices. You're not taking people to dinner. You're not sitting in waiting rooms waiting to speak to the doctor or the dentist or the potential referral. Majority of your patients will be coming from the actual dentist in the practice. That being said, a lot of times, depends on the community that you're in, you may get referrals from around the community because some of the Aspen offices have very good relationships, and they'll send, knowing that we're the only oral surgeon in that particular community, you may get patients from outside. But the majority of the patients are internal. You have a flexible schedule. As you guys can see, in order for me to do what I've done for the last 10 years, it had to be flexible. For me to be able to do Indiana University, to do Clear Choice / Turning Point, it had to be flexible. So I was in charge of my own schedule.
And
I
don't
was
forget to be a father to 3 young daughters, one
correct.
twins.
Twins, yes.
So
Correct. So
very flexible.
flexible. So that's what was probably the best thing for me. Usually I said this at the beginning, but I didn't. I know when we graduate, we all have this desire to want into the trauma, recon, orthodontics, and financially that may not be the best decision based on our student loans. And sometimes we feel like, we have to either or. I felt like for me, Aspen really gave me that opportunity to choose neither. I could do, or choose either, I should say. I could choose to do academia and I could choose to do private practice. It's definitely a team approach to the provider success. I'll go into that a little bit more. There's obviously the business and clinical collaboration. And the biggest thing that people ask me is the clinical autonomy. I literally was talking to a young lady this afternoon prior to this call, and she was saying, what am I supposed to do? Am I going to get thrown into the wolves? Am I going to be given a specific number? And this is what I have to hit every day in order for me to have my job. And that is furthest from the truth. One of the things that we specify at Aspen is that it's your license and you are going to do what you feel comfortable doing. And that should be 100% of the time. So nobody's going to put in our specific scenario, nobody's going to put a ASA 4 or ASA 3 patient on the schedule and tell you that, hey, you need to deep sedate this person and you need to do a full mouth extraction and put X amount of implants in. And if you don't do it, then you can't work here. You have the ability to review your schedules. obviously you have that relationship, you have your set of clinical preferences that before you start, we all work together on that. What are the type of patients that you want to see, how much time you need and stuff like that. But the bottom line is that you will be treating the patients that you want to see and you feel comfortable treating.
And if I could just stop you there for 1 second, because I think something that you said a few minutes ago is really important to kind of reiterate. This is another one of those things where majority of the dinners that I do, another one of those things where everyone's kind of surprised. So Aspen does not have any non-competes and there's no restrictive covenants. You used the C word before, contract, which I don't like that word, especially because Aspen essentially really does not have a contract. What Aspen has is a very, very simple, straightforward standard letter of agreement with an agreement on both parties that if something's not working out and you want to leave, or it's not working out for the practice owner and they want you to leave, that you're giving each other a 90-day courtesy so that we can find someone else or vice versa. That's like, all of that is so huge because I think that really is what makes us different than a lot of not only other DSOs, but even private practices. So many private practices have contracts with, a length of time, 1 year, 2 years, 3 years. I've seen up to 5 years, or some of them have in their contracts that, you can't work anywhere else. You can't work within a certain mile radius. You can't work within a certain mile radius, even a year or two after you leave that practice. So there's so many things there that, to your point, Dr. Brown, you come out of residency, you aren't really sure what you want to do, and you kind of feel like you have to make that choice. What I think Aspen does really well, and especially for new residents coming out, is you don't necessarily have to make that choice with Aspen, because Aspen allows you to do whatever else you want to do at the same time that you're working for Aspen. So if you're not sure that Aspen is right for you, you can dabble in it a little bit and still do something else, still work at a surgical practice or work at the hospital, or, we employ a lot from the military, because if you have a military commitment, obviously you don't have that much time to commit elsewhere. And so a lot of people in the military will work for Aspen, 1, 2, 3, 4 days a month. And again, I think for a resident, I just think that that's a really, one of the things that would be on the top of my list if I was coming out of residency, as far as why Aspen would be a good opportunity. So I think you can do a lot of different things while you're doing Aspen, and you can kind of figure out what it is that you like and what you want to do.
Yeah, well said, well said.
Sorry.
So no, you're good, that's good. So the specialty support team, these are your lifelines. You have Christy Bashwinger and Veronica Figueroa, and basically these two ladies, they go through your commission reports, that they can answer any question that you may have about your production, in terms of your payments, in terms of your instruments, in terms of getting stuff fixed. And if they can't fix it, they'll find somebody else. It's as simple as having an IT issue, signing on, getting your prescriptions. We have a whole onboarding team. So when you decide to commit and you are now officially on board, there are a couple of people who come out with you prior to you starting and going forth. So they actually work with you, help you unpack your stuff, get you familiar, get you all signed in. But these two ladies are the people who are pretty much the big bosses. So delivering on patient needs, just like any standard private practice, you're seeing third molar consult and removal, you're doing sedation. That's definitely a big desire in the United States. People want sedation, medically compromised patients, of course, and of course that has different levels that we follow. I'm hoping that the surgeons that we have follow all the AMOS guidelines and ASA guidelines in terms of what is safe to treat in the office. Implant placement, huge. Removal of bone and soft tissue, tissue grafts, biopsy. And as I said, specifically from my territory, I worked in an area where most of the specialists did not accept insurance. So as Aspen being providing access to care and basically making ourselves available, I saw a lot of outside referrals with very good insurance.
Just to stop for one quick second, if anyone has any questions, there is like a chat Q&A function at the bottom of the screen you should see. So you can type any of your questions in there. So we want to make this interactive. Please feel free to stop myself or Dr. Brown at any time to ask whatever questions you have. Nothing is off the table.
Yeah, Mel, if any questions come through, just let me know, please. So the GP and OS collaboration. This is an excellent, I did not experience this in residency, but what we do and what we provide definitely complements the general dentist skill set. So this is the biggest success. I know initially, a lot of times when DSOs talk to patients or talk to residents or oral surgeons, we will say, you just have to show up. And if you show up, your schedule will be built. And if you just want to be mediocre and just want to be normal, that's not what we want or desire, at least for myself, I should say. You want to definitely have that collaboration with the GP. And the Aspen, I'm going to show you guys some numbers towards the end of the short presentation about what happens when there's a great GP and OS collaboration, because then you get to see the medically complex patients for surgical procedures, you do joint diagnosis and treatment. One of the benefits of Aspen is that we are far ahead in terms of the technology that we provide. Majority of, all the offices that have been built in the last 3 years have CBCTs. Anything within, I think, the last 10, that is owned, there is a CBCT or office with a CBC that is very close by. We have a planning service where our prosthodontist, Dr. Sandeep Rawal, who is the senior VP for implants, he has a couple of people on his team where if you are interested in doing guided surgery or having a prosthodontist treatment plan your cases, it's actually live, where this program that we use, you sign on, he signs on, and basically the implants can be moved together. You can ask questions and you can go back and forth on where the implant should go. Then a guide is printed and then sent to the office. Not 100% mandatory or what you need, but those of us who are interested in guided surgery, that's an advantage. So atrophic jaws, fixed full arch, zygomas, everything that you could possibly think of is a possibility at Aspen. Site development, sinus lift, ridge augmentation. So benefits of the Aspen Dental Network. Again, I'm going to show you some numbers shortly, but definitely above average industry earnings. We have a large array. We have probably 89 surgeons currently, a mixture of full and part-time, mostly full-time. Part-time guys to be full-time, this is extremely important. To be full-time at Aspen, you only have to work 15 days, right? That means you have 5 days to do whatever you want. Some people use that 5 days to do nothing, which is amazing. And some people do that 5 days to build a private practice or work at a hospital or do missionary work. So it makes a huge difference when 15 days can give you full benefits. The benefit package, obviously for the full-time person is more. There's a vehicle that you can get. Your assistants can get a vehicle as well. That definitely helps out with your traveling and everybody knows how difficult it is to get dental assistance. Now, having that vehicle is a huge benefit. And for us, driving around depends on your radius. Having a company vehicle with a very small, minuscule minimum monthly payment definitely goes a long way. There's no monetary investment. So prior to, I'll use Melissa's word, your LOA, your letter of agreement, and you decide that this is the direction that you're taking, you get a list of the instruments that we typically provide. So we have a template that we follow. but a lot of people say, well, I don't use this instrument or I don't need it, I prefer this. So we go through that with you in detail. One of the huge benefits of Aspen having 1,000 offices, having 2,000 dentists, 89 oral surgeons, is that we have huge purchasing power and we can do things at scale. Everything that we use is brand name, top of the line. There is no compromise. That's one of the huge benefits that I saw. We partner with the biggest of the biggest. So you are using Strawman, BLX, SLX Active. I can't tell you the price that we pay for it because we're supposed to not advertise it, but it is impressive. And because we have that scale, everything that you are afforded to is at a reduced cost. I've worked at different places in my career, and I have seen the huge difference, even from buying from the same provider or distributor. You can see the price difference. And of course, Aspen is the largest network of peers. There's no other oral surgery group that you can become a part of where you can collaborate, you can bounce things off of. We have surgeons that have been with the company for 20 plus years. I've been myself 10, and I'm definitely not the most experienced or the most tenured. So you definitely have somebody. A lot of times residents ask, well, this is my first job. I really want to team up with somebody. One of the things that I provide in my role is mentorship. And when you get to that stage, we connect and we kind of go from there. So it's a shared commitment. Anything, Mel, or no? No, cool. For practice owners, what are they committed to do? To provide a strong patient volume, basically to fill your schedule. That is what they're there for. And that could be 8 patients, 9 patients, 6 patients, 7 patients, 10 patients. That is whatever is agreed upon when you have that initial meeting. Create an environment.
Yeah, if we can pause there also, because again, just from experience with doing dinners with residents, this is always something that we spend a lot of time talking about. Again, in residency, it's very different than being out in the world of outside of residency, where you're working and you're needing to get patients in your chair. As a specialist, no one's really, well, not no one, but most of the time, someone is not sitting at home saying, you know what, I really think I want to, have this tooth pulled. And they're, Googling oral surgeons and coming to you. They're coming to you because they went to a general dentist first who told them that they need to come to you. So without that, that is your lifeline. You guys, you're not working, you're not making any money. So prior to coming to Aspen, I worked for Patterson, which is Henry Schein's biggest competitor. So they're a supplier. And all of my customers were obviously dentists. So I worked with general dentists and I worked with every specialty in dentistry. So, OS and ortho and peds and perio and pros and endo and everybody. And when I would ask my customers, what keeps you up at night? Like, what's your biggest headache? Literally number one answer every single time was getting patients in the chair. And if you Google this, statistically, the referrals from general dentists to specialists are actually declining every year. And there's a lot of speculation on why. My thoughts is probably because advancements in technology. So like general dentists maybe now are able to do certain procedures or things that maybe they wouldn't have done 20 years ago because they weren't able to have a cone beam image, or they didn't have access to a digital scanner or whatever it is. And there's like all these different AI programs and stuff now that and treatment planning software that we didn't have 25, 30 years ago. So a lot of these things make it maybe a little bit easier for a general dentist to do some of these procedures. Now, a lot of times in the specialty world, that they're doing these things and maybe they shouldn't be, but they're still doing them, right? And they don't want to let the patients go. They don't want to send them out somewhere else. They want to keep them in their own chair. Where I think that Aspen does such an amazing job for specialty, that's actually one of the things that drew me to this job, is that you're working together with the general dentist, you're working in their practice, you're working in their office under their roof. So it's a lot more beneficial, and they're more incentivized to give you that patient, because they're not sending them out somewhere else. They're keeping them in their office. They're keeping them under their roof. It's better for the patient, right? They're going to get a better standard of care. You're producing volume in that general dentist practice, so that's going to their top line also. And so when you're a specialist at Aspen, your chair is, for the most part, always full. And that is something that sounds kind of silly and trivial, but in the real world, that's something that you should definitely not, take for granted, because that's not always the case. And especially if you're going into some kind of a private practice or a surgical practice and you're coming in as an associate, a lot of times those owner doctors are over promising and under delivering, in the sense of, they're hiring you on, and you're kind of going in under the pretense that they have enough patients to fill your schedule and make sure your chair is always full. And that's not always the case. Sometimes they're hiring you on because they think that they can use you as the marketing piece to go out, and market their practice for them. So, and you're the one out there, like you said earlier, taking general dentists out to dinner, or bringing the coffee and the donuts, and, kind of bribing them to send patients to you. And at Aspen, you really don't have that. And that, to me, is just so huge. And as a resident, that should be something that you should really be, considering top of mind.
True. Access to preferred vendors and suppliers, I touched on that earlier. The offices, practice owners help you to secure assistance, and of course to provide support. What are your commitments, or what is expected of us? Get your state license, your DEA, your CSC, station permits. We have an entire credentialing team that will help you through this process, have your packets, but ultimately, it's on you, but we do have a team in place. We ask that you commit to whatever you committed to on your locations, that you fulfill them. Most offices, once a month is all that is needed. However, I covered a couple of offices that the volume was so extensive that visiting the office twice per month was necessary. Obviously, for us, if I'm visiting the office twice a month, that's a very good office. We want you to travel and maintain your equipment. Some of the equipment that we are provide, it's very expensive. We set you up for success in how you should carry your stuff. If it's a monitor, if you're in a state where you could travel with your monitor, we provide the cartridges and everything to keep the monitor safe. If you're in a state like Florida where you can't travel with your monitor, then a monitor is bought for each location. Build a relationship with teams. I hinted to that earlier. My most successful offices were the ones where I had a really good relationship with the general dentist covering the office. And of course, goes without saying, providing good clinical care. One of the things that we take for granted, or probably don't consider, is that Aspen is a big brand and it's a big target for everybody. And what happens in an office in California will affect an office in Florida. So it starts very small. If the providers take care of the patients, then obviously everything will work itself out. One of the things that Aspen does really well is, compared to many of the other interactions that I've had with other oral surgeons, and from their perspective, is that Aspen takes care of the patients and they take care of the doctors. And ultimately, what we want you to do is take care of the patients. And that's how the system works. So our vendor partners, Henry Schein, which is the largest by far supplier of everything now, basically. We partner with ACE, Carestream, Cava, Southern Anesthesia, and ACE Surgical merged together. So they're one company, and I did say Strawman. So don't get too blown away by this chart. This is what they show you. As a bottom line, this is not what is okay, this is what you need to do, this is what you need to go to and produce. But I put it on there to show you what the average earnings of a first of somebody 1 year out, 2 years out, 5 years out, and of course a part-time. Now, obviously part-time fluctuates because a part-time person at Aspen could be 14 days, it could be 10 days, it could be 2 days, could be 1 day. So our average this 304 $4,000 is the average part-time earner. So this is kind of more in detail. So last year, 2021, the average first year earnings was about 783,000. Sorry, the average second year earning was about 1.1, and the average 5 year earnings was about 1.5. That's average. The top 20% of earners last year in Aspen did 2.4. So huge difference. And it's not, it's a combination of different factors that turns you into a top earner. But one of the biggest thing is providing good clinical care, as well as being available and building those relationships with your dentist. And of course, according to the ADA, private practice, which is probably low, 420, but regardless, 783 after working 1 year out of residency. It's not bad. It's not bad. So I did this recently. One of my responsibilities is that I have a program where I bring new Aspen oral surgeons to Chicago. We have a huge headquarters, one of the headquarters in Chicago, and I provide mentorship. I help with scheduling, just help with some procedures, stuff like that to help you off the ground. I've had doctors who have been with Aspen for 6-7 years that have been benefit from this program, and I have people who just begun. So what the numbers that I showed you last year was 2021. This is this year annualized, and the average person this year, instead of doing I think 1.1 is doing 1.9, and there's an average full time. So people who are working 15 days or more, and then the top 20% are doing almost 3 million. So almost 600,000 more than they did last year. So really impactful numbers. Numbers don't lie. You know, you could be anywhere on this line graph, but of course, doing a bottom 20% is still a great producer. So it's up to you on where you want to fall. Nobody's telling you where you need to be. I just show it to show that, hey, if you do certain things and you put certain things into practice, this is where you possibly could be. And Aspen helps you to just realize your personal goals for yourself. Some people, it may be, family balance, work-life balance. For some people, it may be production. Whatever the case may be, we are here to support you. I think that's it now. I don't know if anybody some people normally ask me to go back and
look at the money slide.
yeah, that's usually
That's what everybody wants to go back and look at.
yeah.
It still impresses me every time I see it, and I look at it every day. So a couple things that, just from some of the things that you were saying that I know come up, and like, when we're out together, when I'm lucky enough to have you with me at a dinner and we do this whole presentation, the numbers are impressive, and a lot of the things that we talk about support wise and benefits, those are really impressive. But I think a lot of times what residents want to know more is like, I guess logistically and just what does a day-to-day look like for an Aspen oral surgeon? Because like they can look at these charts and they can look at these numbers, but what does that actually mean when you're putting it into practice? Being that our specialists do travel and it's not the traditional practice model where you're in one office, I know especially for oral surgeons, because what you guys do with sedations, obviously there's a different level of what's the word? yeah,
higher level of care
think
anticipated.
of it, that's involved. So you have to definitely be more careful. And sometimes the idea of moving around from office to office and not being in a certain office for post-op care and things like that, those are the kind of questions that I get a lot from residents as far as like, how are you able to practice safely, operate safely, and like, what does your day-to-day look like from a safety standpoint, and also just like, logistics, consult, post-op, all of that.
So again, it's clinical authority. So you are the person in charge. I can tell you how I did it, and for the most part, how most people do it. So I have these when I started, and I do it every year, sometimes shorter if there is, turnover, or things change. So I have this presentation, and basically it's a presentation where I invite all of the Aspen doctors, the office managers, the directors, the regional managers, and Aspen pays for it. So you're not paying for it. And basically, it is an opportunity to set forth guidelines, how you want your post-ops to be seen, um, how you want patients to be handled, what is a level setting in terms of expectations. So this is what I come into the office, and of course, it's you know same expectations, but it's also feedback, because I'm allowing the general dentist to say, okay, well, this is what I envision us to do. This is how we should work. This is how much time. So from a safety standpoint, um, in the offices, even though it's a general dentist practice, they usually have one or two rooms with doors, and it's not plumbed for oxygen, but there's oxygen tanks. Everything is OSHA set up where the tanks are in the specified locations. Everything is set up prior to you getting there. My particular offices that I went to, prior to getting there, they would empty all the drawers to make sure that I had space to put my stuff. So it literally took me, when everything was on point, which it usually was, I would say 10 minutes to unpack my car. So I had tackle boxes, and I tell the oral surgeons this all the time. It's almost like having, instead of having cupboards in your offices, or drawers that you're opening to set up the room, that what your assistant would be doing. I had these big tackle boxes that I personally got from Lowe's. Everything was labeled, gauze, everything that I would potentially need. So in the morning, my assistants got to the point where it took us 10 minutes to unload, if that, and maybe 20 minutes to set up. And we could transform a general dentist operatory into a fully oral surgery suite. And of course, it may sound daunting, um, but I will tell you, after you do it for a month or two, it becomes second nature. I did it for, again, almost 10 years, and I never thought that I would ever stop. At first, I was like, man, this could be tricky, because I was in residency and the same operator, the same desk, everything was the same every single day. The good thing with Aspen is that all the offices look alike. They build out, they're all the same. So you go into office, you could literally sometimes close your eyes, open your eyes, and you're in a different office, but everything looks the same. Chairs are the same, everything is the same. From a safety standpoint, again, that's a big one for me, to Melissa. The safety really comes back on you. So in terms of medical release, medical history, one of the things that I specify at these doctor dinners that I have is that, how do we communicate with each other? Because ultimately, I'm only there once for the month, and majority of the time I'm meeting these patients for the very first time. So you have to set expectations in terms of, okay, I have a set of post-operative instructions, and we have all of these things built out for you, where you don't have to print anything. The office manager does all the paperwork for you. So you come in the morning, the contents are there, everything is there, medical history is there, medical release is there if needed. If you say, hey, if the person is on a blood thinner, I want this. If the person has COPD, I want PFTs. So you set all of that in motion. Remember, it's just it's just the general dentist, for the most part, only know as much that was taught them in dental school. So it's up to us to provide that additional level of care to say, hey, you know what? And the good thing is that majority of them probably have worked with an oral surgeon before, which has its pros and cons. But the pros is that they know what can be done safely. I did that answer the question, Mel?
Yep. As far as consults and like post-op follow-ups and also post-op complications, if any do arise, which of course you didn't have any.
Yeah,
But
yeah.
let's say you did. What would
Okay,
happen? Because if you're not in
so
the office every day, sometimes that can get tricky. So walk us through that.
so good question. So majority, and I've had that myself, that question asked me many times. In oral surgery, majority of the patients who have a complication, 90% of the time, it's their patients come in for I'm swollen, right? Or I had a little bit of a bleed. My sutures dehisced. Um, Basically TLC. I have a dry socket. It's because technically, in all honesty, if your patient is having an anaphylactic reaction or is truly having a critical urgency or emergency, you're not telling them to come to you. If you're in private practice, you're not telling them to meet me at the office. You're telling them to go to the ER. So majority of the patients who need a post-op is just for you to set the expectations. Hey, if a patient call and they say, hey, they're swollen, right, you had surgery, but have them come in. You know, sometimes they just need for you to say, oh, okay, Mrs. Brown, you had a full mouth extraction yesterday. You had 22 teeth removed and you had bone reduction and you had 8 implants and you're swollen. And we discussed this prior to starting. So, and personally, what I did, I don't recommend this to everybody. We do have a way of how patients can contact you. I had my cell phone number. Definitely not recommending that to everybody, but there is a 24-hour line that's set up, so it would automatically go to the general dentist, and the general dentist can let you know, hey, this patient just called, and usually they're having diarrhea, they're having upset stomach from the medicine, they're possibly having anxiety, etc. So that's how that is handled.
And what about consults? Are you doing consults with every patient, or is the patient coming to your chair ready for surgery?
So the pre-expectation is that the 90% of the patients should be prepped and ready to go. However, you should, which I did, and most people do, is that you again go over the expectations, what is to happen. But every now and again, you'll have a patient that says, you know what, I don't feel comfortable seeing the general dentist. You're not doing the procedure. I want to speak to the surgeon. And in those cases, I did have a column on my schedule just for that patient who needed, who may have had a complicated history. That's a huge one. To general dentist may say, hey, this patient is on 10 different medications that don't look the healthiest. They had a medical release, but I still don't feel comfortable. That's an opportunity for you to say, you know what, just put them in for a consult and I'll see them and then we can go from there.
Perfect. And to your point earlier, that's where your relationships with the general dentist that you're working with in the office are going to come in, right? Because a lot of times they are the consult and they are prepping your patients. And so that having that relationship and that expectation, right, of what they're expecting from you and what you expect from them, so that when the patient gets to your chair, it's the right type of patient, you have all the medical history and you're ready to go. And the word I was looking for before that I couldn't remember was risk. It popped into my brain later. For what you guys do, there is a certain elevated level of risk. That's what I was trying to say. Call it mom brain. I don't know. My kids are 12 and 9. Can I still use that excuse?
Oh, so I said before you go to the next question, one of the things that we have available now is the Teams. Aspen used this Microsoft Teams, which is HIPAA compliant. And what I did for every office was to create a Teams group. So it would have the dentist, it would have the office manager. Basically, it is a method of communication where they could send you an X-ray, a picture, a video of a CT, um, and we could say, hey, this is outside of their treatment planning realm. You're here next month. This patient wants to be seen relatively quickly. This is how I can share information with you safely, and we can go back and forth.
I didn't even know that. So you see, I learned something on this call. That's great. So if Aspen, we showed the compensation slide, and obviously oral surgeons at Aspen are doing extremely well financially, but obviously, as we all know, that means you're producing a lot if you're making a lot. So a lot of the questions that I get sometimes from residents is if you're doing a lot of sedations in a day, if you're seeing a lot of patients, and a lot of those patients are sedation patients, which in a lot of cases they are, who is the one that's recovering those patients?
So, good question. It's one of the things that I had spoke with this same young lady as I mentioned earlier. She has been out 5 years, and you learn to tailor your technique. In that, majority of offices don't even use, and this is even in private practice, where we don't even use a recovery room. So personally, it's up to you, because again, this is how you practice. If you're giving fentanyl and Versed 2 minutes before you finish, 5 minutes before you finish, you're going to expect that patient to be in the chair longer. You should I followed the modified Aldrete score, which had all the information that I need to make sure that how the patient was pre-op versus post-op. But ultimately, you are in charge of discharge, basically. So if the patient is not safe to go, you need to keep them. I've had times where I might have an older individual and they didn't recover as fast. There's always chairs available in the office where you could say, you know what, Mrs. Thompson, you're taking a little bit longer to recover than usual. You're breathing fine, your blood pressure is fine, but you still seem like a little bit sedated. So we're going to keep you a little bit until it's safe for you to go home. And that's still totally acceptable.
Let's see here. Wait, we do have a question here. Sorry, I'm going back and forth between two different screens. That's why my eyes are back and forth. So just like a couple of general logistic questions. I know we went over so much, but just like little things that I get asked a lot. How many operatories do you work out of in a typical Aspen practice? I know that might vary depending on the region and the size of the office, but.
I did 2, but I only did sedation in one, and I did locals in the other. So I had sedation set up, and then in my other operatory, it was just post-op consults, like uncoverings, simple stuff that I did in that column. But some people work out of one solely. So that's up to you. There's no mandatory saying that, you have to have 2 operatives, you have to have one. I will say, when you have that relationship with the general dentist, and they know that you come in, a lot of times they will scale back their schedule to make sure that there is ample space, because obviously you don't want the office to be too crowded. So that's again a part of a good office, part so you come, hey, I'm coming, don't overbook your schedule, because then the X-ray machine is going to be taken up, the CBC is going to be taken up, the sterilizer. So the offices that had produced well they anticipated me coming, and they planned it accordingly.
Yep. Again, all about that relationship with the general dentist. How many patients on average does let's say a brand new resident first year working and they start with Aspen, not day one, obviously, but let's say 3 months in, what's the average number of patients that they're seeing in a day, and how many of those patients are sedation patients?
Varies. That varies. So everybody in this call will know that depending on the residency program you went to, you can have very different experiences. Some people have a very good background, very comfortable with sedation. They can fly through a case. Some people not. Some people had very good dental alveolar experiences. Some people didn't. I will say I'm not embarrassed. When I just started, um, I probably was seeing 8 people for the day, 7, 8. That was a good day. I'm taking about an hour with every patient. Um, Last year, probably was taking about 20 minutes to do a set of wisdom teeth. So it varies. And again, there is no set, you have to see 8 patients, and whenever you finish your 8, you can go home. If you want to see 10, that's fine. If you want to see 12, that's fine. Just as long as you're doing the right thing for the patient.
And should we tell everybody how many patients you were seeing when you left us, like you're after, or we don't want to scare everybody? Dr.
So
Brown was a machine.
so it is it big as I said earlier, the longer you do it, you don't want to become complacent, because that's when mistakes happen and untoward effect occur. But basically, it's the same thing you're doing every single day, just like in a regular practice. Wisdom teeth, fusion bonds, implants, bone grafts. So after a while, it's just like, keep the wheels turning.
Yep. One thing we didn't touch on is assistants. So being that you're traveling to different offices, how does that work with your assistants? Do you have different assistants in every office, or?
So for safety reasons, we want everybody to use the same assistants all the time. I have had my assistants for 10 plus years. I treat them really well, and it's a very rewarding job, especially in today's right now, post-COVID. Dental assistants are very difficult to find everywhere. So we implore you guys to treat them well, stick with them, and you want your assistants to know you, like know how you work. This is how I study. This is how I hold a patient. I always start at number 1, and I go to number 16 or 17, whatever your routine is. For me personally, my assistants, because I only work 2 days for Aspen, one of my assistants worked with me at Clear Choice / Turning Point, and she traveled with me. And the other one did too, but when she wasn't working with me, she was working as a general dentist assistant in the office. So there's a combination. If I was doing 15 or 20 days, then my assistant wouldn't have time to do anything else. So yeah, that's how it works.
Awesome. We're coming up to the hour. I wanted to I probably should have prepped you for this question before, but so I'll put you on the spot. If you had one or two pieces of advice for someone who's in their final year of residency right now, they're going through the process, they're trying to complete residency, they're trying to take licensing exams, and they're also trying to find a job and figure out where they want to be and what they want to do after they graduate. What kind of advice would you give someone now that you're so far removed from that, right? You've had all this life experience.
So actually, not quite. Remember, I teach, so I'm faculty at IU. So I get these questions all the time in terms of what should I do next. I want to do what you do. I don't want to do what you do. So so I get this a lot. So I feel that more so than ever, residents have so much opportunity, because there are so many DSOs and there's so many opportunity. Things are a lot competitive. People back in the day, you worked at a private practice, they would underpay you, significantly. You'd have to pretty much, like your start in residency again. You'd have to build as an associate, then you would have to become a partner, then you'd have to pay off that loan. So you wouldn't be making any, good money until, you're 7, 8 years old, 9 years old. You don't have to worry about that anymore, because now, as a new young resident, you have the world at your fingertips. You could choose to do, a lot of us, whether you do a 4-year or 6-year program, you spend a lot of time on your education. So, and depends on the type of lifestyle and the work-life balance you want to obtain. So I would say there's no reason to rush and make a hasty decision. whether it's Aspen, whether it's another DSO, if there's not this mentorship person that inspired you, some of us don't. I didn't have that, where you have that person who, mentored you along the way, and your dream was to go back and work with them and do that. And if that's the case, that's fine. That's great, because now you have a friendship, a personal relationship, and professional. But for those of us like myself that I didn't have, there's no reason for me to could go to New York or stay in Florida, who was open to anything. Aspen allowed me to explore my opportunities. And again, since there was no contract, you know, I could leave at any time. I will tell you guys on this call is that, again, when I left residency, Aspen was not on my radar. It was not even close. And here am I now, a matter of fact, Indiana, you guys may have not noticed, but I'm actually from Jamaica, right? So if throwing that out there, and
You were from Indiana.
yeah, I know people. I trick people a lot. So, I I had no idea that coming to Indiana. I said to myself, "Hey, I can go anywhere for 2 years." I trained in Jack. I went to UF of Florida. I mean UF of Jacksonville, and I said I can do anything for 2 years. I took a 2 year faculty position at Indiana. Started with Aspen, and 10 years later, I'm still here. So I will say, don't lock yourself in. If you choose a state that is very, compact, that the competition is there. And if you don't have family ties, you don't have a spouse that is, committed to something else in residency school, has a great job, then I would say, don't leave any opportunity unturned, like explore, whether that is with Aspen or somewhere else.
I love it. Love it. Good advice. If anyone has any other questions, I think we kind of went through everything. 8:29, so we'll end it here. Thank you so much, Dr. Brown, for doing this for us. For anyone who is on this call that wants to share this with a friend, this video will be on YouTube probably in 2 or 3 days. Dr. Brown and I are YouTube stars. Well, the funny thing is I tell my kids that, and then when they actually watch what I do on YouTube, they're like, "Mom, no, you are not a YouTube star." But maybe one day, good aspirations. But thank you so much for doing this. Thank you to everyone who hopped on. We do have a $100 gift card that we're giving away for anyone who joined in and listened in for the full hour. So I'm going to be putting the names in a random kind of automated thing on a web page, and we'll pick a winner. So if you win, myself, Kristen, or Ed will contact you tonight or tomorrow to let you know that you won $100, a little extra holiday cash.
Is my name is in that?
Absolutely not. Absolutely. Actually, you're paying for it.
Oh, good.
Just kidding. But thanks again, guys. Thanks everyone for coming on. Thank you, Dr. Brown, and everybody. Have a great rest of your night. Have a great holiday season, and we'll see everybody soon.
All right, guys. Thank you.
Bye.